thanks for being here with us today. We're here today to celebrate the state's commitment to fighting Alzheimer's and dementia and supporting the over 580,000 Florida families that are affected by the disease. As we mentioned, Mary is with us here today. Her husband, Mike, is a resident here at the Windsor at San Pablo. They were married in 1964 and have been blessed with 3 children and 7 grandchildren. Between raising their kids and running a business, they were able to build a wonderful life together. Many years passed before Mike began forgetting minor things, but it did not initially seem unusual. Mike and Mary enjoyed traveling around the world and especially spending time at a lake in Georgia. Memory issues continued to progress for Mike, and eventually he received the diagnosis of Alzheimer's. The family could no longer bring him to places like Disney World for fear that he would walk away if you were not carefully watching him. He now resides at the Memory Care neighborhood here and receives excellent care. But the story of Mike is across our country, but particularly here in Florida, all too common. We know that the likeliness of Alzheimer's increases with age. 5.3% of people ages 65 to 74 have been diagnosed with Alzheimer's or dementia. That percentage increases to almost 14% for people aged 75 to 84, and then over the age of 85, it rises to 35%. Alzheimer's is the most common cause of dementia and the 6th leading cause of death in the state of Florida. More people lose their lives to Alzheimer's than breast cancer and prostate cancer combined. But despite those numbers, we're undeterred. We're committed to offering our support and look forward to the medical breakthrough that will eventually bring a cure. Today, I'm proud to highlight a more than $12 million increase in Alzheimer's and dementia funding, bringing the state's total around the state that provide comprehensive diagnosis and referral services and community programs that support individuals and their families. The budget continues to include $5 million for the Ed and Ethel Moore Alzheimer's Disease Research Program within the Department of Health, which awards grants for research relating to the prevention, diagnosis, treatment, and cure of Alzheimer's disease. Research right next door at the Mayo Clinic is funded through this program and offers educational and support programs, as well as opportunities to participate in clinical trials and medical discoveries. The Mayo Clinic serves 11 counties in this area and estimates that in these counties there are almost 57,000 residents with Alzheimer's. As we know, with so many diseases, early detection is key. In the past year, they have completed over 200 evaluations and almost 100 free memory screenings. They have also trained almost 1,500 caregivers, first responders, healthcare workers, and others whose family or friends may be suffering from memory loss through an education program to provide those who interact with individuals with Alzheimer's or dementia with the knowledge and skills they need to do so effectively and respectfully. Our strong financial commitment allows Florida to prioritize the advancement of research needed to combat the disease. Not only that, we've actually built it into the foundation of our public health priorities. I'm proud to say that Florida is the only state that has Alzheimer's disease and related dementias listed as its own priority within a state health improvement plan. So in Florida, we continue to put seniors first. Earlier this month, I proclaimed June Alzheimer's and Brain Awareness Month in Florida, and just yesterday, people across our state came together for the longest day to raise awareness for the care, support, and research efforts of the Alzheimer's Association. So we continue to support the work being done in the state of Florida. We're happy with the progress that we made in this year's recent budget, and we look forward to being able to do more in the years to come.